Hi, everyone. This is Dan Toner, the health insurance broker for Axis. We're here to talk about Axis Group Biz Plan and the annual renewal, which is January 1. 39 pages is a lot for the attachment, so I'm not going to go over all of them. Just some housekeeping items. As you go towards the back of the memo, you'll find my contact information. So right here on page 15, that's my company, FFP, Amanda, my right hand, and Leslie, and then that's my information right there. Well, some contacts for Aetna and Blue Cross. We are going to renew all of the existing plans with the current carriers. So with Aetna, there are 3 plans offered today. We're going to add a 4th. We're going to keep the Blue Cross Blue Shield dental plan. The benefits and costs are pretty close to last year. And we're going to keep the Blue Cross Vision plan, which uses the Davis Vision Network. When you get to the next page 3, you'll see a little brief summary about the 3 different plans. The 8150 is existing today, the 1500 is existing today, and the 4000 is existing today. What's brand new is this 3500. I've given you a description here as it goes into the page 4 as well, just in writing you can see. So I'll kind of summarize that for you. On the first plan, it is our lowest costing option because you have an 8150 deductible, but what makes it unique is that you never owe anything to see a primary care doctor all throughout the year. You never owe anything. 0 deductible waived means you don't owe anything for urgent care centers. That's not an emergency room, that's an urgent care center. And you know nothing for generic drugs. All the plans have 100% coverage for well visits. So you're really getting 4 items paid at 100% with no cost to you under this plan. Everything else, specialist, x-ray, labs, hospitals, surgeries, imaging like radiology, MRI, CAT scan, PET scan, you pay the Aetna discounted rate all the way up until 8150, and then you don't owe anything for the rest of the year. So catastrophically, you owe 8150, but there's so many other benefits that are 0. And that's why we like that as a base plan. If you're looking for a little bit different coverage, like you need copays for things like specialists, we're going to show you option 2 that's brand new. You have a $35 copay to your primary, $75 for specialist, $75 for urgent care. At the pharmacy, 3 different numbers, $10 for generic, and either 50 or 80 is the copay you pay for preferred and then non-preferred name brand. When you have the bigger bills, hospitalization, surgery, radiology, and emergency room, you have a $3,500 deductible. You owe 20% of the bills on top of that, but you can't spend more than $7,000. That's your worst case scenario. So a little bit different than the first plan in that you have copays for things that are subject to the deductible, like specialists and name brand drugs. Plan 3 is similar to last year's. You do pay a higher copay than option 2 to the doctor, but you have a less deductible and a little less out of pocket for hospitals, surgeries, and MRIs. So option 3 is there because it was there last year. Option 4 is some say the richest plan in the sense that when you have bigger bills, hospitals, surgeries, MRIs, and emergency room, there is a $4,000 deductible, but then you'll see a lot of zeros after deductible. So that means when you have those bigger bills, you owe up to the first 4, but then you owe nothing else afterwards. That's an existing plan today. So that's a little description of the plans. The company is paying $150 a month towards your insurance. This selection sheet will be provided to you. There's 1 page for the medical. You'll see the 4 plans and you'll see your cost per paycheck at the bottom. If you want to be covered by yourself as a single, you'll check that off. You and a spouse, you and children, 1 rate, no matter how many children you have. Kids are covered up to 26. And then employee and family is you, spouse, and all the kids that are under 26. So it's 1 rate again. These are your deductions. So you'll check off the plan that you want. If you're declining coverage, you check. sign and date, and you'll give that to Melissa. And we've asked December 2nd. That Monday is the cutoff, giving you a couple of weeks to make your elections. This is the dental, very similar plan to what you have today. You're using the Horizon PPO network. You have coverage in and out of network. You have 100% coverage for checkups, cleanings, exams. I have listed in the kit, I'm going to go over page 11 here. You can see what's covered at 100%, 80, and 50. Everybody that's covered gets a $1,500 maximum, and that simply means if they're paying 100%, for example, for cleanings, exams, x-rays, they pay 100, you pay 0. Whatever they pay out goes towards that 1,500 max. So say they pay out $200, that means you have 1,300 left to use for other services. January 1, you get a fresh new 1,500 of benefit. On the vision side, we're keeping the vision plan. There's no cost, no change in premiums. Vision is a network called Davis Vision. Horizon does not have a network of vision providers, so they rent Davis Vision. If you go on the Horizon website, you click Find a Vision Provider, it sends you right to Davis Vision. This Panorama IVB plan simply says you can get your eyes checked and pay a $10 copay every year. If you're getting a pair of glasses, excuse me, you can get them done. You can get the lenses done and pay a $25 copay every year. If you're doing frames, you can you'll get $130 cash plus 20% off every 2 years. And contacts, you'll pay a copay of $25, and you can do that once a year. Contacts in lieu of frames. And there's a little summary for you there. On the Horizon site, this is a little just how to look up your dentist. Again, that's the contact information. And then I've provided you a lot of information from Aetna. So they have no cost at Minute Clinics at CVS. They're owned by CVS. So there's some information about there. Over the counter, they have deals with over the counter medications. They also have a deal where you can get a $25 every quarter. You can actually receive $25 of incentivizing stuff of cash that you could use at CVS. There's a little bit more information about their telemedicine, their virtual, and their relationship with CVS. This is the in-store that I was talking about that you can get $25 to spend on over-the-counter it says every 3 months, but it's actually improved to it's every 3 months, but you can do that. So that's actually $100 a year. And they have an EAP program, an employee assistance program. Okay. So just outlining that coverage. Again, my name is Dan Toner. For those of you that are hired during the course of the year, you have a 90-day waiting period. At some point in the first couple of weeks of employment, Melissa will introduce you to us if you're a new hire, and then we'll get you this kit. We'll send you a link to enroll. For those of you that are existing today as we start 2025, this is open enrollment. And again, we'd like you to make your decisions. Today is Tuesday, the 19th of November. We'd like you to wrap it up probably by Friday, the 29th. On Monday, the 2nd is really the absolute deadline. We have to get all the enrollments and changes to all the different insurance companies. I wish you guys a great holiday, and please call me if you need anything.